You can call us in on 0116 212 9324. I'm going to repeat that again, 0116 212 9324. You can text us on 07450 925084 or join us on Ramadan FM on Facebook. If you do so, there's a live stream going on at the moment, so join us in. So let's proceed with the Ramadan special on EAVA 102.5 FM. Without much further ado, I'm going to introduce my guest today, and we've got a very special guest, Dr. Hisham Haq. Assalamu alaikum and welcome, Hisham.
Wa alaikum assalam, viewers, and wa alaikum assalam, Shahid.
Nice to have you here. Now, just a bit of introduction. Hisham is a general practitioner in Leicester City, but that's not all, because Hisham is involved in a lot of work. He's also a treasurer for the Leicestershire Medical Committee, local medical committee, and he's also a very, very, very active member of an association called APNE. Now, APNE stands for Association of Pakistani Physicians of Northern Europe, and Hisham was just recently elected as their social secretary, but I've just been informed it's not just the social aspects of the organization which he manages. He's also part of the corporate affairs, which I understand, and we were talking just before the show, that he has been very much active part of the corporate affairs. I've known Hisham for a few years, and I've always known him as an extremely active person who's a doer. So it's a pleasure to have him, and it's brilliant to have him to take out his time today. So Hisham, thank you once again.
You're welcome. Pleasure is all mine.
Thank you, Hisham. Right, Hisham. Now, I know that we're going to be touching on various aspects like blood pressure, arthritis, diabetes, asthma, respiratory problems like chronic obstructive pulmonary diseases, depression, and types of medication that are taken in these conditions. But before we start off, Hisham, can you just educate us or tell us, as a medical doctor, what are the effects on the body when an individual fasts?
Fasting is something that Muslims know well of, and it is one of our 5 pillars of Islam. But fasting is also something that has been done through age immemorial, and multiple people through various walks of life throughout the ages have always fasted. The effects of fasting are not always fully understood and how it actually benefits the whole body, but we all have a lot of anecdotal evidence that it is fairly useful for us. I was looking into some research recently about fasting, and some of the best form of research that we've got is only on fasting, which is being done for 10 days at a time to collect the data on the various subjects. And this study was quite interesting, because what it says was in 10 days, the flora or the amount of bacteria within the gut completely changes. And what we talk about changes is that the bowel is actually full of bacteria. And there are more bacteria in the bowel than there are human cells in the whole body. That gives you a bit of an idea about how compact this thing is and how much of a different environment it is. Now, when we have seen subjects fast for 10 days at a time, that whole flora can change, and when it changes, it has a direct effect on your mental health, it has a direct effect on your physical health, and it also has a direct effect on the amount of food and hunger that you tend to have. I'll give you an example. Say, for example, when we have looked at subjects and when we have looked at the amount and the capacity of the stomach, how big that is, after 10 days, that capacity actually shrinks by 1/3, which means that you automatically have a 33% less requirement for food. Now, when we've looked at these subjects, the study was quite specific, and the subjects at the end of this 10 days worth of study, they were able to eat much less, and they were able to have sustained benefits as well. However, what happens is that if we keep challenging this in the stomach with huge amounts of food at the end of the day, then you tend to negate that aspect. But what the studies were very clear about was that the whole gut flora changes, the whole number of bacteria within the bowel changes, and when they change, there are huge positive effects in terms of... My apologies.
A busy man.
My apologies. My apologies.
No worries.
My apologies. So when the gut changes, the way that the gut actually tends to use medication also changes. And what we mean by that is that when you eat a tablet or when you take some medication, the body breaks the medication down. It then has to go through the liver. The liver automatically destroys 80% of any tablet that you eat on the first go. That is called as a first pass effect. And then it's only the 20% of the medication which then tends to work throughout the rest of the day for you.
That's really interesting you say that, Hisham, because basically what some individuals do is they take one medication, say this is not working, and then decide that they either stop taking it or sometimes they take more without talking to the professional.
Absolutely. I think it's very important that with any medication, we need to understand that medications take some time to work. Before we tend to disregard medication, we've got to give them enough time before they actually settle down into your system. Usually, common side effects whenever you introduce a new chemical in your body will be will be felt for the first week to 10 days, sometimes even up to 2 weeks. After that, it should settle down. When I do say that with a bit of caution, because in case if you take a tablet and you stop retching, I do not want you to keep on being sick or violently sick or ending up with rashes without actually stopping the medication and speaking to your doctor concerned. But yes, equally, when you take any medication, before you understand whether it's doing anything for you or not, you need to give it time.
Absolutely, and that just reminds me, Isham. I've being a psychiatrist myself, we've just done the latest work that's coming in, research that's coming in psychiatry. It's more of an association rather than a cause. Is what we call nutritional psychiatry, and a lot of research is being done. And I know some research has been done in America, and some research is being done in Oxford at them. And some of the things. We will share the link on Facebook. We will send it on our live stream. Is that you are what you eat? It's always been an old adage saying you are what you eat. And like you said, the flora and fauna. And the flora and fauna is basically the bacteria that we have inside our stomach, also known as the gut. And is that depending on how much you eat, what you eat, it impacts on the release of certain chemicals. The bacteria activates what we call serotonin, and serotonin is something which may or may not cause depression or anxiety, and 80% of serotonin is present in the gut, and then that stimulates. So depending on what you eat, you may actually damage some of the blood vessels, some of the nerve endings which actually promote some of the serotonin. So it's really, really important. I'm really glad you've touched on the gut bacteria. So tell me, medication is one thing, Hisham, that individuals, how it's normally taken and it's absorbed and why it's important for people to continue taking the medication. But just coming back to in relation to the gut, I mean, obviously you said that reduces or shrinks by 1/3, provided people haven't had a lot of pakoras and samosas during Ramadan. That's important, isn't it? But it's important to know that it's an ideal time. Somebody told me that, Ramadan is a good opportunity to just remind ourselves as to what we should be doing for the remainder of the year. And because we discipline ourselves, or hopefully discipline ourselves, it's basically getting ourselves ready for the remainder of the year. And it's not just the spiritual element of it, it's also the health, how we healthily manage ourselves. Wouldn't that be correct?
Absolutely. I think I couldn't agree with you more. You've summed it up when you talked about the effects on mental health with what you eat as well. Because they are now finding a direct correlation between gut health and your mental health. Yeah. And the better the gut health, the better the mental health. Now, the phenomena isn't really understood as well, but there is a lot of work going on because it's an increasingly interesting field. Medicine is keeping on changing at present. When we started off with medicine in the 50s and 60s, we were mainly preoccupied with infections which were killing the human race off. Now what we find is lifestyle changes. So the new generation is lifestyle changes, and that's the crux of our disease at present. Obesity by itself tends to promote a lot of the problems that we have, either in terms of mental health or in terms of joint problems or diabetes or blood pressure or heart disease. They are all interrelated.
Absolutely. So, talking about medication, Isham, now, before we go to medication, what would you say as a professional, as a general practitioner, let's take it out as a generic term or on a generalized term. If somebody comes to you who's pretty much fit, what would you, and they're going to be fasting, if they're not on medication and they're going to be fasting, what would you expect their body to go through in simple terms so that the listeners can understand during fasting? What not eating throughout the day, not drinking water throughout the day. Please, if you can take both of them individually, not having any nutrition during the day, how that impacts on the body's metabolism, the fat, etc., and not drinking water. And then we go to the next part, is that then what is important then, what to eat during Iftari and Sehri? So you can answer the first question, and then we'll come to the second part.
Yeah, thank you very much, Shahid. Very, very interesting, and there's obviously a lot of science involved in all these things, and the question actually forces me to cover nutrition, what foods are there, what types of foods are there, and then it forces me to talk about how these various different sorts of foods are used, and then how they're stored in the body, and then how the body starts to utilize these sort of different foods as well. I'm going to make sure that I try and use very, very common language and keep the terms very, very simple. So very simply speaking, I will probably divide nutrition just into carbohydrates, proteins, and fats. Now, all three things are very, very important, and you have to have a bit of a balance in your diet. And when we talk about balance, I cannot get away from talking about portions, because the biggest problem that I have, or even when I started to study into diabetes, and I went through different courses in terms of diabetes at the World University, the concept of portion was very, very alien to myself, and also I find that increasingly for my population that we do not talk about portions. We get a plate full of food, and we're told to finish it up and not to waste food. So carbohydrates basically make up the bulk of our diet. When we talk about carbohydrates, we talk about rice, we talk about potatoes, we talk about bread, we talk about chapati. Carbohydrate is what the body uses first. So it is sort of a bit like your petrol. It's what your body needs as a first go. Protein is basically what goes off to make your muscles. So it makes all the muscles, and it gives you the strength side of things as well. And fat is basically extremely important because you need that as the insulation around all your nerves. Fat is part of your brain as well. And fat is basically your store of energy, which makes you last throughout the day. Now, when we talk about these sort of things and what we eat and how does that impact throughout the day, depends upon the person. And you can actually be a very athletic person, a very young person. You could possibly be someone who has got a sedentary job where you're just sitting behind a desk, a bit like myself, and you're not burning off enough calories. Or you could probably be someone who has put on a lot of weight throughout the last 12 months and is a bit on the overweight side of things, or even on the obese side of things, and has got multiple issues and problems. So when you eat food, once the food is digested, the food makes its way through the liver detoxifies and takes away any of the stuff that it doesn't like, and then the nutrition gets into the bloodstream. When the nutrition is in the bloodstream, sugar is used first of all. So the carbohydrate is broken up into sugar, that is utilized. Protein is used to repair the body. So in case if there are any muscles damaged, injured, then the protein is used to take forward all the repair process, make the new skin, make the new organs, make the new enzymes, which are chemicals which the body essentially relies upon to take over its day-to-day functions. Fat is then stored around the liver, in the skin, underneath the skin, and fat is very important because it provides a lot of insulation, provides a lot of protection for all the blood vessels around the whole body. So carbohydrates are used first. Protein is used to repair, and whatever protein is left in the body, if you've had sort of like say too much protein, or your portion of protein was higher than your portion of carbohydrates, then that protein too is converted into sugar and stored in the liver. Fat is then utilized. Now, once all these stores are kept, then the body will use them throughout the next 12 hours or 16 to 18 hours of fasting that we're doing at present. It will probably tend to utilize all of the stores throughout the day. So carbohydrates, and then when we talk about nutrition, can then be divided into quick release carbohydrates. So if you have something sugary like a sugar bar or sugar in your tea, that is utilized first. So that will be utilized within the next 2 hours. Whatever sugar is left, and if there is too much sugar in the body, then the body will convert that into extra fat as well and store that as fat. So that is just as a crux. It can sound quite confusing, but the body converts one form of food into the other form of food, and utilizes the other way around. the body cannot convert any of the stored fat or sugar into muscle or into proteins to use. So protein is the only thing that you need to make sure that you have on a consistent basis. Fat and sugar are interchanged. Sugar is used very quickly within 2 to 4 hours, up to maximum 6 hours, and then the fat reserves will then start kicking in after about 6 to 8 hours to get you over the line for the rest of the fast.
Excellent. Thank you very much for that very comprehensive overview of what kind of foods we require and what's really important. Ideally, what should one have for sehri or getting up for breakfast in the morning? What would be the ideal? Now, you've touched on carbohydrates, you touched on proteins and fats, but obviously individuals to see themselves throughout the day, what would be the ideal food? We've got something here. It says, sorry, we've got a message, Hisham. It says, I have lost weight, but I am still fat. How is that possible? I have lost weight, but I'm still fat. So probably that's a trick question for you, Hisham.
No,
That's a riddle, I think.
No, I can completely empathize because with me being a GP and when I sit in my clinic, I'm sat on my desk for long periods of times. In fact, I sit at 9 and I don't get up till about 6:30. So I completely get the essence of the question which I'm being faced with. In all the 10 years of me being a GP and doing this work, I do have a scale in my room, and when I stand on it, it does not seem to move.
Yeah.
It is so I completely understand the essence of the question. What happens is that it's input and output. So if you've lost weight, partly you might lose weight because there might be a degree of dehydration which is going on, but you are actually still burning off a lot of calories because you have gone into a bit of a deficit. Now, the thing is that if you want to see real change, you have to be doing something on a very sustained basis in terms of burning off more calories, exercising at least half an hour, at least 4 or 5 times a day, and then you need to be expecting changes maybe at the end of 6 months or 8 months. Just the month in itself is not enough, and if you have lost even a bit of weight, that means that you're doing quite well, that you're losing or you're burning off enough weight, but you're not replacing all the calories straight after.
So just very quickly before we go for our break, we've got about 1.5 minutes. What would be the best kind of food, do you think, for story time?
Slow release carbohydrates.
Which would be?
Slow release carbohydrates are things like oats, things like chapatis might be something useful as well. And then you obviously mix it up with other nutritional elements as well. So you need to have a small piece of fruit on your plate as well. You need to have a small amount of meat on your plate as well. And you need to try and decrease any fried stuff. So if there is any fried stuff, then that usually turns into triglycerides, which is called as the bad fat. So if you've got a balanced plate of food, a small amount of bread, which is called carbohydrates, some starch over there, brown rice versus white rice, that's basically what you're looking for. You're looking for things like oats, you're looking for things like chapatis as well, and you're looking for a small amount of meat and salads, and then you have a plate which you tend to form.
Okay, thank you. That's really helpful. We've got a lot to cover still, and we're going to be talking about medication. We also have some questions, and we've got a number of people who have joined in, but what we're going to do is we're going to come back after the break. So just a reminder before we go on a break, please join us on Ramadan special EAVA FM 102.5 FM. You can call us on 0116 212 9324 or text us on 07450925084, or you can join us on Facebook on live streaming. This is Dr. Shahid Latif, your host, and see you shortly on the other side.
Assalamu alaikum. My name is Muhammad Abdul Wahid and I'm the local fundraiser for Human Appeal here in Leicester. Human Appeal is a charity that's been going on for more than 25 years and working in more than 25 countries around the world. This Sunday, the 19th of May, at 1:30 p.m. through till after iftar, we will be having our Radio Pledge Day down at EAVA FM on 207 Evington Road. That is 102.5 FM. Please tune in, come down, donate to us through that way. You can call up and donate. We'll have plenty of pledge points in and around the city. We aim to paint the city purple. So inshallah, we look forward to hearing from you, to seeing you and seeing all those donations come in for those needy around the world. Inshallah, this Ramadan we aim to be one, so let's do that. Jazakallah khair. Assalamu alaikum. My name is Muhammad Abdul Wahid and I'm the local fundraiser for Human Appeal here in Leicester. Human Appeal is a charity that's been going on for more than 25 years and working in more than 25 countries around the world. This Sunday, the 19th of May, at 1:30 p.m. through till after iftar, we will be having our Radio Pledge Day down at EAVA FM on 207 Evington Road. That is 102.5 FM. Please tune in, come down, donate to us through that way. You can call up and donate. We'll have plenty of pledge points in and around the city. We aim to paint the city purple. So inshallah, we look forward to hearing from you, to seeing you and seeing all those donations come in for those needy around the world. Inshallah, this Ramadan we aim to be one, so let's do that. Jazakallah khair. Assalamu alaikum. My name is Muhammad Abdul Wahid and I'm the local fundraiser for Human Appeal here in Leicester. Human Appeal is a charity that's been going on for more than 25 years and working in more than 25 countries around the world. This Sunday, the 19th of May, at 1:30 p.m. through till after iftar, we will be having our Radio Pledge Day down at EAVA FM on 207 Evington Road. That is 102.5 FM. Please tune in, come down, donate to us through that way. You can call up and donate. We'll have plenty of pledge points in and around the city. We aim to paint the city purple. So inshallah, we look forward to hearing from you, to seeing you and seeing all those donations come in for those needy around the world. Inshallah, this Ramadan we aim to be one, so let's do that. Jazakallah khair. Assalamu alaikum. My name is Muhammad Abdul Wahid and I'm the local fundraiser for Human Appeal here in Leicester. Human Appeal is a charity that's been going on for more than 25 years and working in more than 25 countries around the world. This Sunday, the 19th of May, at 1:30 p.m. through till after iftar, we will be having our Radio Pledge Day down at EAVA FM on 207 Evington Road. That is 102.5 FM. Please tune in, come down, donate to us through that way. You can call up and donate. We'll have plenty of pledge points in and around the city. We aim to paint the city purple. So inshallah, we look forward to hearing from you, to seeing you and seeing all those donations come in for those needy around the world. Inshallah, this Ramadan we aim to be one, so let's do that. Jazakallah khair. Assalamu alaikum. My name is Muhammad Abdul Wahid and I'm the local fundraiser for Human Appeal here in Leicester. Human Appeal is a charity that's been going on for more than 25 years and working in more than 25 countries around the world. This Sunday, the 19th of May, at 1:30 p.m. through till after iftar, we will be having our Radio Pledge Day down at EAVA FM on 207 Evington Road. That is 102.5 FM. Please tune in, come down, donate to us through that way. You can call up and donate. We'll have plenty of pledge points in and around the city. We aim to paint the city purple. So inshallah, we look forward to hearing from you, to seeing you and seeing all those donations come in for those needy around the world. Inshallah, this Ramadan we aim to be one, so let's do that. Jazakallah khair. Assalamu alaikum. My name is Muhammad Abdul Wahid and I'm the local fundraiser for Human Appeal here in Leicester. Human Appeal is a charity that's been going on for more than 25 years and working in more than 25 countries around the world. This Sunday, the 19th of May, at 1:30 p.m.
Assalamu alaikum and welcome back to Ramadan special, EAVA FM 102.5 FM. I'm your host, Dr. Shahid Latif, and like every week we've got a special guest, a fantastic guest, Dr. Hisham Haq, and we've been talking about the effects of Ramadan, fasting on the body, and we're going to be talking now about the kind of medication that individuals take. But before we do that, let me just remind the listeners that you can call us on 0116 212 9324 or text us on 07450 925084 or visit us on Facebook as we are live streaming. We've also already have recently been joined by Naeem Briscoe, Ips Dewan and Ahmed Dada. Thank you very much for joining us, and we got a number of other people. It's a long list, I can't go through them. But we do have a question. Someone's texted us in, Maulana Safraz. Thank you very much for your kind message. I'm going to read it out. It says, can you please explain opening fast with oily savories? What impact does that have on our bodies, mind and energy? Also the impact of consuming large amounts of food in one sitting. What should we be doing in keeping a healthy diet or balanced diet? Is there any particular type of food we should be eating to help with our fasting? Now, I know Hisham, you've touched on some of these, and you've looked at basically looking at energy foods which can sustain us throughout the day, through Sehri time. But Maulana Safraz has asked us specifically about breaking the fast or opening the fast, and he's spoken about savory and oily food. Now, it's a good opportunity, I suppose, Hisham, to go to the next part, which is when we do break the fast, how can we do it healthily?
I think
without damaging our body.
I think that's really important. So you see, what happened is that you fasted. You're now fasting for up to about 15 hours, 16 hours, and your stomach is empty. It's done quite well. It's shrunk a little bit in size. What that tends to do is it tends to make you less hungry, or you need less amounts of food to start to fill it up. Oily savories is something which is a bit of a honey trap for me. I mean, forget about talking about anyone else, but as I've spent several years fasting now, and the oily savories is something that you look forward to. You might not have it on a day-to-day basis, but when it comes up to Ramadan, that's what you go for. And they're sort of like delicacies for us. But what's happened is that now your stomach is ready to receive food. It's full of acid. And what you do is, if you put oily stuff in on the first go side of things, or within the first few goes, so yes, you've had a piece of date, which is possibly the best food available because of the amount of nutrition, the amount of nutrients, the amount of vitamins inside of it, and a form of carbohydrate which is quite easy for the body to utilize and give you more energy with. That is probably the best thing. So a bit of water, a bit of khajur, fantastic. Now it starts the stomach moving. Once you're starting to do that, if you're going to challenge the food with anything else, keep it something a bit light. Oily foods are very, very difficult for the body to digest. The stomach has to mix the food up, it has to churn it, and it takes the stomach at least about 2 hours to 4 hours before it starts to churn and send the food across onto the other side. A lot of people tend to suffer with acid reflux or heartburn. Very, very common problem. By the time that you're getting nearer towards opening your fast, a lot of people are having a little bit of burning sensation in the chest because of the excessive amounts of acid inside the stomach. And if you're putting oily food inside, that actually makes it a lot worse. It makes it a lot more difficult. Also, what happens is that these energy balls, these savory fried stuff, have got a lot of calories inside of it. And when we start to near towards the end of fast, we naturally start to slow down. If we are in the praying, or if we're going for the Quran, we're not sort of like going out and walking or hiking. And henceforth, you very quickly start to fulfill your energy deficit, so oily savories is probably the biggest Achilles heel for why people might actually put more weight on during fasting and not lose any weight, or remain stagnant, or very quickly not notice much of a change in their things. What these oily savories consist of is deep fried stuff, so there's a lot of fat over there, and carbohydrates which are very difficult to break down. And henceforth, there is a lot of work that the stomach has to do in order to get it up. So bloating in particular is quite a big problem because of the type of carbohydrate which is there. And I would probably say to Maulana Sarfraz that that's probably one of the biggest Achilles heel. So if you can just stay away from those oily savories and do other things, you're actually going to be so much better off. As simple as it can be, simple whole fruits rather than fruit salads which then had sugar put on top, which have then got savories put on top to get the taste out of it. So if you can keep it as simple as possible, a few dates, a piece of fruit, you're then looking at really getting a lot out from your fast.
Well, that's really useful information, Hisham. Thank you very much for that. So simple, keep it simple, listeners. Keep away at the time of breaking your fast, away from savory, oily food. It's going to do you harm. It's going to impact on your digestion, and it's going to impact on your health. So basically, you've empty stomach, as Dr. Hisham has rightly said, and if you're introducing oily and fatty food right from the start, then obviously you're going to cause yourself problems, and the whole day has gone past. Having said that, it's easier said than done. So discipline is the need. Hisham, we've got another question. Someone is asking, one of our listeners is asking, can you fast if you have your gallbladder removed?
I don't see any harm. Yes, I think that the answer is yes, you can fast if you have had your gallbladder removed. The only problem once you have your gallbladder removed is that people tend to suffer a lot more with acid reflux, and when it comes up to Ramadan time, I completely understand that because of excessive amounts of acid in the stomach, so things tend to become a little bit difficult, and acid reflux is quite a particular problem for a lot of people. A recent episode happened when one of my patients, a Turkish Muslim, who's already been on some medication for this symptom, and having had a gallbladder removed, was suffering quite a lot with the medication. And naturally, her request was that this high dose of medication that she was on to control the acid secretion wasn't lasting her throughout these 15 hours of fasting. In those sort of scenarios, the strategy that we had, that we agreed with, was that we took the medication twice a day rather than taking it just once a day. And by doing that, we then tended to cover the whole 24 hours worth of the cycle. And that's then worked for her. So that's an example how the patients working with their doctors can come up to a reasonable discussion and a plan on how to control these symptoms, because this is a problem, acid reflux, and sometimes when you've had your gallbladder removed, some of these people might feel a lot more of this thing, but some, not all.
Okay, thank you very much, and I hope that answers the question, as Hisham has very comprehensively put across. So the straightforward answer to that is there's no reason why it shouldn't. Now, Hisham, let's talk about the chronic conditions. Well, before we do, we've got another question. Salams, my husband suffered from a heart attack back in March, so a couple of months ago. He's on a lot of medication. He's still fasting and taking half of his medication at sahur and half after iftar. Is this safe for him, as the interval between iftar and sahur is 5 hours? Please advise. This very nicely takes us on to the part which we were going to discuss, Hisham, and that was medical conditions and medication, wasn't it? And here we have a prime example of someone who's a couple of months ago has had a heart attack, is on medication. And I know some of the things that you were going to be discussing were cardiovascular medication, including blood pressure. So let's start off with this example. Someone who's recently had a heart attack, is on medication, needs to take that medication, and then we can sort of generalize it to other areas like diabetes, arthritis, asthma, depression, blood pressure, etc. So can you give your expert view and opinion on this particular case?
Well, step one, I'm going to really appreciate the fact that the gentleman has decided to fast on. So full marks to him in terms of doing that. But what he's also got to understand and respect is that his health overall is a responsibility for him as well. Now, heart attacks can be of varying severity. If his severity was not very severe, then it's a very, very good thing that he's getting back into his groove of things. I think he should probably be getting a lot of benefits versus any problems. A lot of the medications that we do tend to have after a heart attack are usually once a day only medications. Some medications might well be which you have to take twice a day, and there are some medications which you have to be a bit careful of as well. So when someone has had a heart attack, they should probably be on 2 medications to thin their blood. One of them is aspirin, the other one is called as clopidogrel. These are 2 medications which are asked to be taken simultaneously for the first 12 months. And what we can do is we can actually protect the stomach a little bit more, because when we take these medications, the risk factors or chances of having swelling around the stomach or ending up with gastritis, or which is basically swelling around the stomach, increase. So the way that I would probably do that would possibly to make sure that he simultaneously has another medication which then protects from the harmful effect of this combination of medication. Once a day medication, no problems between whatever time you take it. Either you take it at Sehri time or you take it after iftar, it should be reasonably okay. The other medications would possibly be the blood pressure tablets. The blood pressure tablets as well are of 4 to 5 different varieties, and most of these varieties can be taken regularly as well. Some of the medications which are not which have to be taken twice a day can have slow release formulations, which means that there are other varieties of that particular medication which, if you were to discuss with your doctor, he could possibly go with you through the various options and change them, at least for this particular interval, into a formulation which is slow release rather than taking it 3 times a day, for example. So there are ways and means around it. And the crux of the question was that the 5-hour mark, is that enough? I would possibly say that yes, it is, because anything above 4 hours is okay for me.
Okay, excellent, thank you. Just wanted to highlight that though Hisham is an expert in this area, this is part of his profession, and this is his area of expertise. But we would suggest that these are views given based on expert opinion. We would say that in relation to your medication, do contact and consult with your own general practitioner or any specialist that you're open with. So anything that we are discussing here are opinions and views, but do discuss with your own general practitioner, because there may be other factors which we are not aware of, which may be important, and your own general practitioner or the specialist may be privy to. Now, Hisham, if we talk about other medication, let me give an example. My wife developed a very bad eye infection last week, and she was asked to start on antibiotics, which she had to take 3 times a day. And the infection was so bad that I was worried that it might lead to septicemia. That means the bacteria or the infection going into the blood, which can be very, very dangerous, meaning that she required that high dose of 3 times a day of antibiotics. But she wanted to still fast, and I advised her not to. She's a doctor, she's sensible, but obviously she said she wanted to fast, but she didn't the first 4 days. The remainder, when it did settle down slightly, she did start to fast, but then she had to readjust her medication, and she did seek medical advice from the specialist. And what they did say that, although we have 5 or 6 hours, it was broken down in such a way. But I'm really glad what you said earlier on, and that is that though it's really good that people take the brave decision, but the most of to fast, that is, but it's more important, and as important, if not, to make sure that we are healthy enough to maintain those kind of decisions, isn't it?
Absolutely, absolutely.
And so moving on slightly onto other areas. So someone who has blood pressure, someone who has arthritis, someone who has asthma, inhalers, someone who has chronic respiratory problems, someone who has depression, for all these conditions, Hisham, individuals need to be on regular medication at least once a day in order to maintain their mental or physical health, I beg your pardon. So can you advise us, or can you give your view on individuals who have these conditions, who are regularly on medication and are probably going to remain on medication for most part of their life?
Yeah.
What's your advice in conditions like these?
Shahid, you're absolutely right. I mean, you presented a bit of a disclaimer in the sense that although we are talking in general senses about what we're talking about, but medicine as we practice in this country is very personalized. We tend to cater it to the individual, and the individual has got one-to-one help and care from the practitioner. And so I see people in all walks of life. I see the very young, the middle ages, the older ones, and the really frail towards the end of life as well. And we do tend to modulate what our advice or depending upon the person's specific. So please do make sure that you go and chat with your doctor or your family physician or your general practitioner, because they would be the people who would probably know more about you. Whenever people tend to have health issues and health problems, we are now getting into a phase where we're calling people, where we're telling people that they've now got multiple comorbidities. What that basically means is someone who's got diabetes possibly also has high blood pressure, possibly also has issues with his kidneys, and possibly also might have a heart problem. And then on top of that, if they smoke or have been a long-term smoker, they will have problems with their breathing. So you can see automatically that so many of their body systems are involved, and that then leads on to frailty. So people have got different types of bodies, and they have got different types of physique, and they've got different types of staminas and resistance towards exercises. Fasting is a great opportunity to start to get the body used to not having too much food inside of it, utilizing better what it's actually got. And if we can actually add on a bit of exercise to this fast as well, rather than having a sedentary lifestyle or slowing down and sleeping through towards the end of the hours, we would actually get a lot more benefit out of these conditions. As a result, it's not unusual for me to see patients who have got 7, 8 different, in some extreme cases, even 20 different types of medications that they're taking off me. And as well as I look at them, I cannot take bits and bobs off from him unless things change on a lifestyle issue, on a personal issue. So in reply to your question, so the work is quite complex because you're having to have a limited amount of time with your patient. You sometimes need more time for when patients have got multiple health problems, and you're trying to juggle things around, because when you tinker with one issue or one problem, you can actually disturb things on the other side, and henceforth we tend to have to strike a balance with all of these sort of conditions that we've got.
Okay, excellent. Thank you for that. Thank you, Naeem Poppet, for also joining us in. These are basically individuals who join in on Facebook, on our Facebook page at Ramadan FM. But please do call in on Ramadan special EAVA FM 102.5 FM. Call us on 0116212 9324 or text us on 07450925084 or join us on Facebook, and you are most welcome to ask any questions that you would like on Facebook as well. We are live streaming, and we've got some interesting topics which we've touched on, and we've got Dr. Hisham Haq, who's a general practitioner in Leicester City, and also involved in a lot of other parts as well. Just a reminder again, Dr. Hisham is standing for the council election for the Royal College of General Practitioners. So any GP out there who's eligible to vote this man in. I can vouch that he's good. He knows what he's doing, and he does a lot of community work. So Hisham, just carrying on, let's specifically talk about someone with diabetes. Yeah. So we get a lot of people who still prefer to fast. Majority of the people I know prefer not to fast because they're on medication. As a general practitioner, what kind of factors what kind of things would you factor in and advise you would give someone who was, say, round about in their 40s, 50s, is on one medication a day and have to be on medication? It's not diet controlled, not on insulin. Insulin would be a different kettle of fish. But say he's on medication like metformin, for example, which is one of the commonest used diabetic medications. So what kind of things would you be looking at, and what kind of advice would you give?
Thank you. Shahid, the best thing about the question was that now we're talking about a particular person, 50 years old, who's on one type of particular medication. Metformin is the best medication for diabetes. The majority of our patients, when they're newly diagnosed, this would probably be our first line of treatment. And although it's a very, very old medication, but it's still one of the best medications available. Metformin itself has benefits in terms of how it works. It also has a benefit where it can help lose weight as well, although it's not specifically licensed for that. So metformin is probably one of the best medications out there. Now, when you take metformin, our usual advice is to always take it with food, never on an empty stomach. Because when you take metformin on an empty stomach, it can actually cause a lot of tummy cramps. That's the commonest side effect with this one. People who don't bear up with metformin usually are the ones who take it wrong, not taking it with food, but taking it on an empty stomach. Now, metformin is also something which works on the body. And when you are fasting, your body is getting a bit dehydrated. And if you take metformin in a state where you are severely dehydrated, it can have negative impacts on the kidneys as well. So what we have to do is make sure that if you do take metformin, you do take it with food, usually after you've opened your fast, Also to make sure that you are very, very well hydrated as well, because within the UK, our fast can last for anything up to about 15 hours, and that does tend to put the body under a lot of physiological distress. Dehydration is very important, and how can you tell whether you're feeling dehydrated or not? A typical example would possibly be that if you feel that your lips are very dry, then you're possibly 10% down on your total body intake. So that's a rough estimate. Now, when you are on metformin or you have diabetes, your doctor tends to do an annual blood test for you. And within that blood test, he looks out for your kidney function, because the kidney function is the biggest driver on making sure whether you can actually continue with metformin or not. In today's day and age, we now have access to our health records, and individuals can check for what their kidney function is like if they are signed up with their GPs in terms of being able to access their blood results. And there is a blood test called as EGFR, which tells you are your kidneys filtering all your body well or not. And if the body is declining in health, or if you've had diabetes for a very long time, you do tend to have the kidney function which goes downhill, and you can actually look at kidney failure as well. The number that you look for is reasonably about 90. If your blood test says that you are 90 or in your 80s, then you've actually got a very, very good renal function, and you can carry on taking metformin easily all the way up to the renal function being somewhere around about 60. No problems whatsoever. After that, you've got to be making sure that you go and speak to your GP so that he's in the picture. In terms of the side effects, because metformin is usually asked to be taken with your meals, we normally do tend to prescribe it as taking it 3 times a day. However, it is possible to break the dose up into 2 pieces, so it is not unusual for me to ask my patients to take 2 metformins with their main meal and maybe 1 with their breakfast, and that usually tends to do them fine. Coming up to Ramadan, if you're going to be decreasing the quantities of your portions, then I would possibly suggest take 1 at Sehri time and 1 with your iftar. At other times when people tend to have too many side effects, we do have a longer acting version of metformin. And what we can do for our patients is that at their request, we can change the medication and give them a slow release formulation of the medication, which would potentially have for at least a short period of time over Ramadan. That's once again a discussion which I would have with my patient, and I would tell them that, look, we do have options. We do want to make it easy. We want to make sure that we see you towards the other end, because it is important for us, and it will be important for not just for myself, but all of my colleagues.
Excellent, thank you, Hisham. That's really, really helpful. And we've got just slightly over a minute. And just a quick question: inhalers. Do individuals who are fasting, can they take inhalers that you're aware of?
So
During fast, that is?
Absolutely. So I think inhalers is something that is not nutrition. It is something which is going into the lungs. And yes, you can actually have your inhalers on a regular basis. And my understanding from a lot of ulamas is that inhalers do not impact on fasting.
Hisham, that's really, really helpful. And I think we've covered quite a lot here, and before we know it, 1 hour has already passed by. Thank you, Kazmi Hashmani Turk and Yahya Patel. You've joined us on Facebook. And Hisham, you know what? It's been absolutely a pleasure to have you. And there's so much to talk about. I think we're going to have to get you back some stage.
The pleasure's all mine.
It's been a wonderful show. And you've been on Ramadan special, EAVA FM 102.5 FM. We will be back again next week with an excellent speaker, but I would like to take this opportunity once again for saying thank you very much to our speaker.
Assalamu alaikum. My name is Muhammad Abdul Wahid, and I'm the local fundraiser for Human Appeal here in Leicester. Human Appeal is a charity that's been going on for more than 25 years and working in more than